Hey, I'm Dr. Shawn Tierney. I'm a musculoskeletal sonographer, and I've been in the field of musculoskeletal ultrasound for about 7 years now, and it's been really life-changing for me and my family and a lot of the people that I've been able to touch. And it really started with meeting Dr. Tom Clark, and now I have the opportunity to help people in unique ways, and I have the opportunity to teach the doctors all over the world to be better doctors and to help more people in ways that they weren't helping them before. So it's a great life. So I appreciate working with the best people, with the group that I learned from the most and the group that I teach with the most, Mskus, just led by Tom Clark, who is also a chiropractor and somewhat of a genius. I think if anybody truly understands him, he's definitely a genius. So the other people that I teach with are really leaders as well. So now that I'm here, I get to do what I love doing. The opportunity that I have is to see people's problems in a way that they haven't been seen before, to address problems in general in a way that they haven't been addressed before. Because with musculoskeletal ultrasound, we can see things differently than we can with MRI or X-rays or CT or other imaging, because we can see things in real time with the tenth of a millimeter accuracy and work with things in real time.
Hello, I'm Connor Baxter here at the 2016 PPG, and it's been an incredible event so far, and we have Dr. Shawn Tierney here working on all the athletes, keeping us in tip-top shape, and with him and all his toys and different medical advancements, it's taken us to that next level.
Hi, I'm Annabelle Anderson, and between the ages of 16 and 24, I treated my body like a car crash. I was crash test dummy. Years of ski racing, multiple high-speed accidents, bike crashes, running, jumping, doing all the stuff that I did led to multiple injuries, from broken bones, but more critically to my right knee. To put it in perspective, I have been #1 in the world at what I do for the last 5 years. That has come at a considerable cost to my body because of the day-to-day strains that the environment, as well as the training that I do and the competition, places it under. To be able to still compete at that top level, having the history of injuries that I had well before I came into the sport, as well as succeed in my mid-30s and still be blowing fields apart of kids half my age and younger, that's unbelievable. And it gives me so much hunger to keep doing what I love to do and have trust that my body can handle it. I always knew that medicine would eventually catch up with science, and that the ability to heal the body using the body's own material was very, very close. When the introduction to Dr. Shawn was made and I had my first appointment, I was a mess. I had just finished up the biggest, most important, most prestigious event of the year in October 2014, and he took one look at my knee and was like, "This is a mess." That was pretty much the exact comments that my orthopedic surgeon at home and back in New Zealand had also said. The difference was the orthopedic surgeon sent me away with a prescription for ibuprofen and said, "Be really grateful that you don't run for a living." Dr. Shawn, on the other hand, was like, "You know what? I think we can probably get you back to a level of stability and improved quality of life." I won't say that the journey has been painless, because the initial PRP techniques were really, really painful. As painful as surgery. But there was the hope of a plan. And when you have a plan, it's like something lights up in mind and you can go, oh my goodness, there is light at the end of the tunnel.
I'm Dr. Thomas Clark. I run this ultrasound course, and the company is called Musculoskeletal Ultrasound. And I started doing ultrasound in 1991, and in 93 I really got myself involved in this and started even teaching a little bit. It was kind of a God's gift. I turned out to be kind of an expert right off the bat, because what I was doing with ultrasound turned out to be kind of what I was doing with my hands before, because I went through some medical school before I went to chiropractic college. Then I practiced chiropractic with some multidisciplinary clinic for 25 years. I saw dozens of people, like almost 75 people a day for 25 years. And then all of a sudden in 93, 91 I got ultrasound. By 93 I was doing ultrasound to every one of my patients. And by 2001 I decided to actually become full-time guiding and doing musculoskeletal ultrasound. By 2001 or 2 I started courses, and I've been doing cadaver courses and musculoskeletal ultrasound diagnostic courses now for almost 15 years. So once that all started to happen, I started to gather all these people that are just awesome, passionate people in the same passion as me. My passion was to learn anatomy and be able to see it with ultrasound, learn the pathology from that, and then after I found the pathology, then to be able to actually deliver whatever that was, whether that's platelet-rich plasma or steroids or whatever, to that spot, fix it rather than just kind of covering up for their pain. So that's kind of where this whole thing got me into this injection side. The diagnostic side I started with before because I wanted to see what was wrong with them and try and treat them with my hands as a chiropractor.
So one of the things that I'd like to talk about that I've been a part of, that I've been honored to be a part of with musculoskeletal ultrasound, is changing the way that people's brains and nervous systems work by resetting the sympathetic nervous system. It's a challenging thing to do. It's challenging because the old way to do it, it's been around, it's called a stellate ganglion block. The old way to do this block was maybe not as safe, definitely not as safe as the way we do it now, and a lot more uncomfortable and a lot more painful, to the point where it probably would not be wise to use it in the ways we can now. So, there is very difficult anatomy in the anterior neck. And in that anterior neck, there's a cervical sympathetic chain, which controls the way that the fight or flight part of the nervous system. In this complicated area where you have nerves that are going to your arm and blood vessels that are going to your brain, and nerves that are going to control your heart and your lung, you really need to know your anatomy well. So it's the highest level of teaching and skill that I'm aware of in what I do. And when I do that, I feel the most valuable, because the skill set required, I think, is some of the highest skill set in what I do. But the skill set is not the interesting part. A skill set is something that we can teach, that people can learn. But the interesting part is that people's lives change. And people's lives change in ways that they would never believe they could. And they will tell you that they don't believe, they didn't believe that they could change like that. And this is a common story. So we're changing lives by allowing somebody to function normally, who was in a hypersympathetic tone, who couldn't sleep well, who couldn't relax well, who couldn't be at peace and enjoy life. Because if you have this hypersympathetic tone, what's going on is that you have the two sides of your nervous system with one overridden by the other. So think of this as your sympathetic nervous system and your parasympathetic nervous system. And they're in balance. I like to use the example of a kid on a roller coaster. So you ever take a kid to a roller coaster? First time? I don't want to do it. It's scary. No, not gonna. No way. Oh, the kids are doing it. I might. I think I might do it. I don't know. Okay, I'm gonna go. Let's go. Okay. Let's go on a roller coaster. All right, ready to go. Ah! I'm gonna die. Oh my gosh. Oh my gosh. Oh! That's the sympathetic came up. Oh, parasympathetic came up. Oh, feels pretty good. Let's do it again. Really? Yeah, let's do it again. You're kidding me, right? No. Let's do it again. It was fun. Come on, let's do it. Okay, I'm gonna do it again. Okay, let's get in line. Okay. All right, here we go. Ah! Die. Whoa! Let's do it again. Oh, okay. All right. Are you sure? Yeah. Okay. Okay. So this is the sympathetic. This is fight or flight, and this is parasympathetic. So if you get something that's exciting, it's really cool if you get done with being exciting and you can relax. But if you get exciting and you don't ever get done with exciting and you can't relax, it's not so cool anymore. So this is being present. This is how we're present. We're like paying attention, we're responding appropriately, our nervous system is in line, our heart's working right, our brain's working well, we're thinking clearly, we're are digesting our food, because this is fight or flight. It's get through that hard day. This is enjoy the sunset. This is enjoy, being with your friends. This is relax. This is sleep. This is digest your food. This is sexual function, and this is get away from the line. How many 10 different ways can I get away? I need 10 different ways to get away from the line, because in case 9 fail, I need that 10th just in case. So I'm going to think of 10 things at the same time, and I'm going to get out of trouble. I'm going to get through this situation that's super intense. I'm going to be on the other side, and okay, it's good now. So that's balance. But what happens if you go on the roller coaster and it's exciting, and you're like, oh, this is so much fun! Oh my gosh! Oh, good night! Oh, I'm upside down! Oh my gosh! Oh, we're stuck upside down! Ah, somebody fell! Oh my gosh! Their brain! Oh my gosh! I saw somebody died! You get off the roller coaster and you're like, uh-oh. I don't feel so good. Because now this got up higher. It's too high. It came down, but not enough, so I don't have this. I don't ever want to see a roller coaster again as long as I live. No. If I ever drive by a roller coaster, I'm going to throw up. And then 20 years later, they feel exactly the same. So what are you going to do? Well, is their brain broken? No. The program is off. The program is off. So now you got to work with this program that's off. It's like, you need a better operating system, because this operating system is broken. So what if we can just reboot it, shut that down, feels better, let it come back up to normal, and restore factory settings, right? That's a lot better. Here we have too many programs running and no downtime. So we take the programs down, come back up. One thing, we can be present. We can enjoy life. We can digest our food. We can sleep. We can remember things. We don't overreact. React appropriately. And probably have better sexual function, better relationships. Because this guy, in this situation, does not have good relationships. Because, for one thing, when you talk to him, he can't hear you, or she, because they got 10 things going on in their brain. And the one thing that's in front of them has very little focus and is distracted.
Really stoked to be one of the first athletes and, in stand-up paddling, doing the Stellate block. Shawn introduced us with Dr. Mahoney and Dr. Cooke, and it was a really incredible operation. Definitely a little nervous going into it. Big needles. I'm not a fan of needles, but right after the operation. Didn't feel much, just was a little loopy. And it wasn't until the next few days where I was really getting that clear mind state and that whole reset of the body. You know, my digestion, I was eating more, everything was just feeling smoother and running more efficient. I was able to stay really focused on training and really put, 120% into every training session, which is incredible. Normally going into training, it's really hard to push to that next level like in a competition. So to be able to have that under the belt was really cool. And it goes to show the next weekend there's 3 races. It was a course race and 2 downwinders in Columbian Gorge, and I ended up winning all 3 events. And that right there alone really proved to me that not only is it mentally, giving me that clear mindset, it's that performance, that extra edge that you need above every other athlete. Nowadays, everyone's training just as hard, putting just as much time and effort into the water, and these little secrets, these little traits are the next step. We're getting into a bigger, more performance sport, and we're becoming more advanced athletes, and these are the kind of things we need. And Shawn was fortunate enough to introduce Zane and I to this, and feeling really incredibly lucky. After the operation, Shawn was saying, if you had higher stress levels, you would maybe feel a little bit more euphoric after the whole thing. And definitely right after that, I was feeling a little bit loopy, definitely had that euphoric feeling. And week after, 2 weeks after, was just feeling real free, not worrying about every little detail, how I'm gonna get to the beach, what I'm gonna do, what fin, what board. It was just, everything was flowing perfectly. I didn't feel stressed, which before a race is key. I've been going and doing racing now for 7 years, and before that competing my whole entire life. And you always get that feeling, that sense of nervous or, whatever it is. And after the whole operation, the Stellate block, it was really incredible. I really felt that weight lifted off my shoulders. I could really focus on what I needed to do, and my thoughts were sharp, precise. Every time I went into it, I knew that was what I was gonna do, and I did it. Where it wasn't like I had a conversation or an argument in my head, like, am I gonna do this turn on the outside, on the inside? It was just boom, I did it. I thought I was doing it on the inside, I turned on the inside. And it really, like I said, went to show for that next event, winning 3 of them. And now we're here at PPG, and we have Danny, Zane, and I, and Annabelle, actually, all 3 of the men and 1 woman done the operation. And we're gonna really prove today and tomorrow really what the benefits are.
Say my name, I wanna hear you call. Hold me close, I wanna feel your heart. I'm in a cold sweat and I want you bad. Now you got me all in my head like that.
I'ma show you out to love again. I'ma show you how to love again.
Say my name, I wanna hear you call. Hold me close, I wanna feel your heart. I'm in a cold sweat and I want you bad. Now you got me all in my head like that.
Okay, to that, I've taught more than several physicians how to do stellate ganglion blocks, and these are within the military. And so they're treating this military population, and it's actually whether I'm treating military-related sexual assault, or whether I'm treating combat-related PTSD, or whether I'm treated PTSD to conditions that happened even before they came in the military. Unfortunately, all of these conditions, each one is extremely common. And when the feedback I get from the physicians I trained is, of all the things I do, this is by far the procedure I like doing the most, because we say in the military, the flash to bang, like when a projectile goes off, the time that you take this troubled person and do the injection, they're feeling better within 20 minutes. They're feeling significantly better. And the comments I heard, even this is coming from patient number 1 that I treated on the table about 10 minutes after we had completed the injection was, I haven't felt this good since high school. And this is a person that had, over 12 years of severe chronic symptoms, nightmare-related PTSD. He just felt that burden lifted off of him. So when I see other physicians saying it's the most gratifying procedure that they do, and I see in my own career, I am a musculoskeletal physician, and I'm not a behavioral health specialist, and treating PTSD was never something that I really set out to do. It's what my patients had. So I was compelled to figure it out because one of my early patients had the impetus to it all. He had crashed his car while he was taking Seroquel, a drug which can cause somnolence, a pretty significant drug with adverse effects. He was prescribed it by an Army psychiatrist, but it caused him to crash his car. And so I was evaluating him and treating him after he had his motor vehicle accident. And he said, "Doc," he goes, "I don't want to take this stuff, but I really can't go back to having the nightmares. I'll do anything. What do you have for me?" I said, "Hey, I don't have anything right now, but I'm telling you, I'll look into it." And that was really where this whole impetus started, and ended up finding out about, hey, this stellate ganglion block might be something that potentially works for you. And we had such great success in our first series of patients. It was the first, although there was a case report on it published by Eugene Lipoff that preceded mine. Mine was the first case series that was published. And we went on to do, large, 166 patient case series, and we continue to collect data on that today. And it's been for these folks, these women that have been raped, these folks that are really, I can tell when someone comes in to the clinic and asks me about this, and they really don't want to talk about it, I'm like, you're here because you're being a total jerk to your children, aren't you? Because that's what causes guys to come into the office, is that they realize that they're yelling at their 2-year-old because he wanted to jump on their chest and wrestle with them. And that's actually what is the kind of final step that makes them kind of retract and say, all right, I really do need to address this. And when you're able to repair that, and not only that, my patients now, I've been doing this since 2009, it's now 2017. I haven't lost track of my patients. They still see me, and every now and then, years will go by and something will re-trigger them and they'll come in for another one. But I'll see them, grocery shopping, or I'll see them out in town. I'll see them with their families, and